Effective communication and precise documentation are cornerstones of safe healthcare delivery. This module reviews common medical abbreviations used in clinical notes and patient charts to ensure clarity and continuity of care for every patient. We begin with abbreviations related to the patient's history. The abbreviation CC stands for Chief Complaint, the primary reason for seeking care, which is expanded upon in the HPI, or History of Present Illness. A provider may note that a patient CO, or complains of, specific symptoms. Essential context for these findings is provided by the PMHX, which refers to the patient's documented and relevant past medical history. Abbreviations are frequently used during physical examinations. PERRL confirms that pupils are equal, round, and reactive to light and accommodation, while EOMI signifies that the patient's extra-ocular eye movements are intact and normal. A finding of HTN indicates hypertension or high blood pressure. Other documented symptoms often include DOE, meaning dyspnea on exertion, and NV, which is the standard clinical shorthand used for nausea and vomiting. Clinical notes also track lifestyle factors using standardized terms. For example, the term ETOH refers specifically to alcohol consumption. Accurate recording of these details is vital for a comprehensive understanding of patient health. Diagnostic testing provides objective data. The BMI, or body mass index, is a measurement calculated from height and weight used to assess body composition and identify potential health risks associated with a patient's weight. Common blood tests include the CBC, or complete blood count, which measures red cells, white cells, and platelets. A subset of this is the H&H, which specifically measures the patient's hemoglobin and hematocrit. Another essential test is the BMP, or Basic Metabolic Profile. This blood test evaluates kidney function and electrolyte levels, providing a snapshot of the body's chemical balance to help guide necessary medical interventions. Following data collection, the provider develops a plan. The DDX, or Differential Diagnosis, is a list of possible diagnoses being considered before the final AP, or Assessment and Plan, outlines the proposed treatment. The plan may include specific procedures like an IND, which stands for incision and drainage. It also includes instructions for FU, or follow-up, to monitor the patient's progress after the initial clinical visit. Prescription instructions use specific Latin-derived shorthand. PO directs a medication to be taken by mouth, while PRN indicates a medication is to be taken only as needed, ensuring the patient receives the correct dosage. Mastering these medical abbreviations is fundamental to navigating the clinical environment. They form a universal language that enables rapid, concise documentation, directly contributing to the overall quality and safety of modern patient care. In conclusion, the proper use of standardized terminology supports accurate patient assessment and treatment planning. Understanding these cornerstones of documentation ensures that every healthcare professional can provide the highest level of clinical clarity.